Holbæk Hospital, and especially the A&E department, has been involved in this patient wristband project. This is a project whose aim has been to integrate, so to speak, the clinical systems with patient identification. The aim of the project has been to test the barcodes on patient wristbands and to try to find out how we could deal with identifying patients via patient wristbands in a more reliable way than we do now. A typical procedure usually involves someone calling and telling us that the patient is coming. It may be the patient's own doctor, the emergency services, or others, which already generates a message that the medical secretary takes and uses to register the patient. And a patient wristband is simply produced from this. When we have patients admitted via a doctor or nurse, we then get this little slip. If we type the patient's social security number into the system, we can see whether they have a record at this hospital, which we order if there is one. We print out their wristband there and then, so it is ready when the patient arrives in the department. First of all, we obviously use the wristband to ensure that we also have the right patient. We usually have the wristband in our hand and ask the patient whether they are the person stated on the wristband. This is confirmed by the patient, a relative, the emergency services, or someone else. After this, the wristband is usually used any time we have contact with the patient. The wristband is attached securely around the patient's wrist, with all the patient's details, including their treatment, usually when in a bed. It was also important to devise a solution so that these patient wristbands could be printed out in a more convenient way than is used now. In fact, we used to produce just labels, which we take and stick to a wristband and put in a little gadget and attach it around the wrist and such like. Now it's very simple. They just wear the wristband. You almost have it in your hand when the patient is rolled in, so that you can identify them immediately and put the right wristband on them. This can save the staff time, because it takes treating doctors and nursing staff a great deal of time to log in and out of the various clinical systems. Our medical secretaries do this too, and the barcode can definitely be used to access the clinical system directly, which also simply saves time. When we have an X-ray done later on, and the lab or lab technician enters any details, this will mean that when a wristband is scanned, it also provides confirmation that an action has been carried out. This also means that it will appear as an action on an overview board. This may even be a huge benefit for us, because it is difficult to get an overview like this. When has a test been carried out and when not? If the patient is input in the system, we put them on our eMatis screen. You then just press a button and the bands are printed off. It's very easy and simple. It's really good to have them there and then, so that you don't need to be there doing it when the patient arrives. And you can go down to the ward straight away with the patient. So when patients are admitted, they can feel at ease and well looked after. It's really clever then that you have everything ready there and then, with the nurse ready to receive them. We're already ahead of the game when the patient arrives. There you go, here's your wristband, they put it on immediately.